The adult human body has 206 bones, and except for the hyoid bone in the neck, each bone is connected to at least one other bone. These connections, or articulations, are called joints. Joints are the location where bones come together. Some joints allow for movement, and some joints are designed for stability and provide little or no movement. The structure of the joint is related to the function, and joints are classified according to the degree of movement. Freely movable joints allow for greater movement, and immobile or slightly movable joints protect internal organs and give the body stability. DIARTHROSIS are an example of movable joints. Within their structure, they contain a bursa. A bursa is a small, fluid-filled sac that helps to prevent friction between bones, muscles, tendons, or skin. DIARTHROSIS joints also contain synovial fluid. And synovial fluid is a lubricating substance that helps to prevent friction between a tendon and bone. Another type of joint is an AMPHIARTHROSIS joint. And an AMPHIARTHROSIS joint is considered partially movable. And then you have the SYNARTHROSIS joint, which are immovable joints. But let's bring our attention back to the DIARTHROSIS joints and talk about them. So most diarthrotic joints are found in the appendicular skeleton, and they give the limbs a wide range of motion. You have ball and socket joints, which are found at the hip and shoulder, and these joints allow for the most movement. How they work is one bone has a ball-shaped head that fits into a concave socket of the second bone. Next, you have hinge joints. Hinge joints move in one direction, and an example would be like your knee and elbow. The hinge joints allow for bending and straightening. Continuing with other types of diarthrosis joints, you have pivot joints. And pivot joints allow for rotation around an axis. An example would be between the first and second cervical vertebrae. And this type of joint there allows for side-to-side motion of the head. You can also find pivot joints located in the wrist. And how pivot joints work is you have an extension of one bone that rotates in a second arch-shaped bone. Gliding joints. With gliding joints, these include bones such as the vertebrae, and they can be described as having a mostly flat surface that glides across each other. Next we have amphiarthrosis joints. And these joints are different from the diarthrosis joints because they aren't as movable. Rather, they can be described as being partially movable. An example of an amphiarthrosis joint would be the pubic symphysis. This is the joint where the right and left hip bones are held together by fibrocartilage. And another example of an amphiarthrosis joint would be the ribs to the spine. The last type of joint that we are discussing are the synarthrosis joints. And these joints are immovable. Okay? These joints provide a strong connection between bones. And this is important at locations where bones provide protection for internal organs, such as the cranial bones. And the cranial joints have a special name, and those names are called sutures. Now we are going to look at different types of motion. So joints allow for different range of movements. Muscles pull on bones, and this produces movement. Flexion is a movement that describes when two bones are brought closer together. Extension is when the angle between two bones increases. Flexion, extension take place at the shoulder, hip, elbow, knee, and wrist. Abduction is a movement that describes moving an extremity away from the midline, whereas adduction is movement toward the midline. Circumduction is a combination of flexion, extension, abduction, and adduction. And circumduction is the movement of a limb, hand, or forearm in a circular motion. This takes place at the shoulder, hip, and wrist. Rotation. Rotation allows a bone to move around a central axis. You have medial rotation, you have lateral rotation, and neck rotation to the right, and neck rotation to the left. Pronation and supination are movements of the forearm. With pronation, this is the turning of the palm of hand downward, and supination is turning of the palm of the hand upward. And that concludes our discussion today on joints and types of motion.